Okay, it looks like you're all set.
I'm live.
Yep.
All right, perfect.
All right, I hope to see you guys in a bit.
Okay.
Hi, Dr. Kelly.
All right.
Thank you.
Dr. Kong, do you want to put up your first slide, the background effect?
Oh yeah, I love this slide. Okay. All right. Can are you guys seeing the whole slide, not the presenter view?
Whole slide.
Great.
All right. Welcome everyone to our COVID-19.
Yep. All right, I hope to see you guys in a bit.
All right, now that YouTube is muted, I want to welcome everyone to our COVID-19 community forum. I want to thank, first and foremost, our translators, Kayla Vieira and Angela Norena, for providing Portuguese and Spanish translation. We unfortunately had technical difficulties with our Arabic translation, but we are going to translate this presentation and send it out to any family who requires Arabic translation. So first, I'm going to explain to everyone how to access translation if you need it. When I enable interpretation, you're going to see a globe on the lower right-hand side of the bar at the bottom of your screen. You simply click the language you'd like to hear this webinar in, either Spanish or Portuguese for this evening. And at that moment, when I enable this, you will hear that this presentation only in the language that you select. All right, I'm going to pause here and I'm going to allow Angela to translate those directions in Spanish.
Buenas tardes, bienvenidos a este foro. Lo que el señor Galucci está explicando en este momento es que cuando él active la interpretación, ustedes van a ver un globo en la parte de abajo, un globo en su mano derecha, y este globo va a explicar los lenguajes o los idiomas, está portugués y está español. Si usted necesita español, por favor, actívenlo y simplemente le hacen clic, apretan y él inmediatamente va a activar para que ustedes solamente escuchen la versión en español.
All right, now, thank you, Angela. I'm going to pause and ask that Kayla gives us those directions in Portuguese.
Boa tarde, eu gostaria de dizer sejam bem-vindos a todas as famílias que estão participando do nosso Fórum Comunitário do Covid-19. Nós teremos disponibilizados intérpretes em espanhol e português, e para as famílias que necessitarem interpretação em árabe, que será disponibilizado depois para quem solicitar. Assim que começar o momento de disponibilizar a interpretação, você vai ver na parte de baixo da sua tela um pequeno globo, onde você pode clicar e escolher a língua que você gostaria de ouvir. Você vai poder selecionar espanhol ou português, e a partir do momento que você selecionar o idioma, você vai ter somente o áudio naquele idioma.
Fatima, are you still with us? Can you unmute, if so?
What you say?
Are you still with us? Yes,
Yeah,
you are.
yes.
So actually, it's recognizing you now for Arabic translation. So do you want to repeat the directions that I had just stated, if you heard them? If not, I can repeat them for you.
I didn't hear it.
Okay, great. So if someone would like to hear the presentation in Arabic, when I enable translation, in the lower right-hand side, there's going to be a globe. They're going to have to select French. Arabic is unfortunately not available as a language, but we use French as the title, but they will hear you in Arabic. So can
Okay.
you, yeah.
Yes. مساء الخير جميعا وشكرا للحضور. إذا أردتم الاستماع باللغة العربية اضغطوا على الأيقونة باللغة الفرنسية، لكن يكون السماع بالعربية عوضا عن الفرنسية، وشكرا.
All right. So I am now going to enable translation and get us underway. Give everyone a moment to select their language. All right, and I'm going to get us started. So thank you everyone for joining us tonight. We've obviously entered a new phase of the COVID-19 pandemic that we've been working through for the past 2+ years, or it feels like that at least. And I want to thank everyone in our community, families, staff members, and students, and our continued partnership with the Revere Board of Health that's been so instrumental in keeping our school programming effective and going throughout this pandemic. Not only the work that we do to keep our schools safe for the school program, but also the additional work in offering testing and vaccinations that are readily available and sometimes challenging for folks that are not members of our RPS community. So I'm going a little fast, I'm going to slow down. Without further ado, I would like to introduce our panelists tonight who are going to be presenting. With us tonight, we have Dr. Natalie Kong and Lauren Buck from the Revere Board of Health. We also have Dr. Stuart Levitz and Dr. Robin Ingalls, who specialize in infectious diseases. The one piece before I turn it over to Dr. Kong, when we get to the Q&A section, please utilize the Q&A function if you are watching on Zoom, or you can put your question in the Google chat. I will be monitoring both, so getting to your question might take a bit, but I promise you we are going to answer any and all questions that are posed. And with that, I'm going to turn it over to Dr. Natalie Kong. Dr. Kong.
Thank you, Dr. Gallucci. Thank you, interpreters. I will do my best to speak slowly so that everyone can hear what I'm saying. First off, I just want to say thank you to all who are joining tonight and recognize that these have been a challenging 2 years, truly 2 years, but really a particularly challenging couple of weeks as we have entered into this new phase of the pandemic where we're seeing a very contagious virus with a pretty high case count. I know it's been difficult at the schools, and I know it can be difficult as parents to navigate what is the safest thing to do for your child. I know it's been difficult for the school nurses and difficult for all the teachers, so I just want to acknowledge that it's been really hard. In thinking about developing this presentation, I literally Googled soothing image because I think we all need to take a bit of a step back, breathe a little bit, and just kind of pat ourselves on the back, because we all truly are doing the best we can to keep our children, ourselves, our community safe. It's been a tough landscape. There's been a lot of new changes, so it hasn't been easy on any of us. And I landed on this image because personally for me, there have definitely been moments where I myself got a little lost in the forest through the trees, and I kind of forgot to see the big picture. And making this presentation for all of you kind of allowed me to step back and see that. So I hope I'm able to clarify some of the new changes that have come at such a rapid pace these last few weeks, and hoping to answer your questions and hoping to get us all on the same page, but most importantly, hoping to get us all to kind of, again, see the forest through the trees and see the big picture again. So what's going on? I think a lot of folks know the Omicron variant is really what's causing this big hullabaloo. It's 2 to 3 times more contagious than the Delta variant, which is a large reason for why we are seeing the enormous numbers that we are seeing in our city, in our state, and truly nationwide. If there's any silver lining to any of what I'm going to tell you, it's that Omicron so far is causing a milder illness. And the thought is that it's causing milder illness because it's more likely to infect the cells in your nose, and it seems to be less good at infecting the cells in your lungs. So you're going to see all the same symptoms of COVID that we all know and are familiar with at this time, but more predominant like sniffles, cough, less predominant shortness of breath, less need to be hospitalized. And in fact, we are seeing that you're 50% less likely to be hospitalized than Delta. However, I want to preface that and say that even though we're less likely to be hospitalized, the volume of cases, the sheer number of cases is really what's putting a stress to the system. So even though it's a milder illness, the volume is still high, and we will also benefit from the usual things that we've been doing to help reduce our risk for COVID. And I will get to that in more detail in a later slide. Another interesting thing that I think the concept of which will be important in a later slide is that previous infections, so for example, if you got infected several months ago with maybe the Delta variant, that it seems to be less likely to protect you against the Omicron variant. However, so that's why we're seeing folks with repeat infections. However, if you are infected with Omicron, it's more likely to protect you against Delta. And that's why in the United States, Omicron represents, greater than 90% of the new infections. There's really no more Delta out there. It's really all Omicron, and that's the dominant strain right now. So just to, again, take a step back and make sure we're all on the same page. This is a graph of the COVID cases that I took directly from the Massachusetts Department of Public Health website. And you can see over here, this is a spike we have been dealing with. For reference, this was the Delta spike. And this was the very beginning, March 2020, right? This is the whole course that we've been through these last 2 years. March 2020, Delta spike, and this is now. So when I say the volumes are huge, like they're huge. It's a milder illness, but the case numbers are high, and that's what's putting a lot of stress on the healthcare system, on all of us, on our schools, on the airline industry, you name it. I will say, you can see from the last few days of this graph here that the case numbers are falling. They are falling, and I don't want to get anyone's hopes up, but it seems like we may be past the peak in Massachusetts, and we are seeing a decrease in cases. So I hope that provides a little light at the end of the tunnel for everyone listening tonight. A lot of other states in the East Coast and the Northeast, like New York, like New Jersey, they're also reporting fewer cases day by day. And this is also what we saw in South Africa. South Africa was the first to identify the Omicron variant, and they saw a rapid, quick increase in their cases, and then a rapid decrease in their cases too. So we're hoping that we'll also experience the same drastic quick drop here in the United States. And so far it seems to be bearing out. And then just for reference, I pulled the Revere cases, which essentially mirror almost exactly the statewide cases. And you can see at the tail end here, the last couple of days, we've also noticed a bit of a drop too. And I just wanted to blow it up, make it easier to see. This is just the last 60 days. And you can see again, on that tail, we're seeing a little bit of a drop in cases. So again, I don't want to get everyone's hopes up, but there is a light at the end of the tunnel. And I hope in the next few weeks, we will be in a much better place than we are today, and a much better place than where we were even 2 weeks ago. All right, so how are we keeping schools safe? I think this is kind of the slide that I'm going to spend the most amount of time on. How are we keeping schools safe in this new phase of the pandemic with the Omicron variant being the dominant strain. Well, as you know, we're continuing our pooled surveillance testing, and that includes a reflex rapid antigen testing for any positive pools. But given the changing landscape of the pandemic, given the change that the virus has undergone, given this new variant of the virus, we are shuffling our priorities, and we're making sure that, number one, we are working as hard as we can, as fast as we can, to identify the positive students in these pool tests. And that's because not only do we want to find who's actually positive, but we want to make sure they're pulled out of classes. And we want to make sure that we take the time to counsel students and parents on the new isolation and quarantine guidelines. I'll talk in a little bit more detail about this later on, but as many of you know, during the holidays, the CDC has reduced the quarantine and isolation times from 10 days to 5 days. They cut them in half. And it can be confusing. It's a lot of new information, but we want to make sure we're continuing to follow the guidelines that the CDC put out and that the Massachusetts Department of Public Health has since adopted. We want to make sure we're educating folks and folks know when to be out of school, when to return to school. Alrighty. We have also recently shifted to reducing our pool sizes. So they're now comprised of about 2 to 3 students instead of the 5 to 6 or even greater pool numbers before. What does this mean? Decreasing pool sizes means that your child is getting an individual PCR test every week, right? If it's just a pool of your child and another child, another student, we're almost approximating being able to do an individual PCR test for every student every single week. This is actually similar to what a lot of other colleges are doing right now. They're requiring each individual student to get an individual PCR every week to keep classes open. All right. This also means that we can reduce the number of reflex rapid tests that we perform later in the week when any positive pools come back. This minimizes disruptions in class, minimizes confusion, minimizes work that needs to be done and on reflex rapid tests, and hopefully minimizes stress and confusion for students and parents alike. Right. The last thing I want to say is that though we are still doing all these things, we are deprioritizing contact tracing. The Mass Department of Public Health is no longer performing contact tracing, and we are also going to deprioritize that in order to emphasize the other 2 more high-yield protocols that I already mentioned. All right, we only have so many hands on deck and only so many hours in a day, and I want to make sure we are using it toward the most high-yield practices that we can do to keep our children and our staff safe. I'm going to take it a step further too, all right, to show you the data for contact tracing, okay? In our system currently, if a student tests positive in a pool, and if we find them in a reflex rapid test, the protocol is to find their close contacts and then to do the test to stay, which is the 5-day rapid test every day. Do that for 5 days straight. We actually were doing that before for, I think, 7 days at the start of the school year, and then that got shortened recently with the new CDC changes. Since the beginning of the school year, among these 3 schools, the data of which you can see in front of you, we have performed a total of 1,353 test to stay rapid tests. And out of that 1,353 tests we've done, we have only identified 1 positive case. No other child has converted to a positive after being identified as a close contact. That's a lot of work that was done to find 1 positive student. Alrighty. So what we're doing, this shuffling of our priorities, we're still doing everything. We're still doing the pool testing, the rapid antigen, all those things. And if there is time, we will do contact tracing. But just know that we're following the data, we're following the science, and we're consulting with other experts like the Mass Department of Public Health, like DESE, like the infectious disease doctors who have joined us this evening, and other physicians, that have volunteered their time and their expertise to help us keep your kids and our staff safe. COVID is evolving, and so are we. Overall, as we move into the next phase of the pandemic, as we've entered a period of vaccine availability, of new treatment modalities for COVID, our goal is becoming more to manage the positive cases, not to try to contain the potential cases that could come about from close contacts or whatnot. The goal is to manage, not contain. We know COVID is going to be endemic. It will be with us for the long haul. We're not going to get rid of it. We're not even going to try and outrun it, because we know it's part of kind of the milieu of viruses that are going to be infecting us on a regular basis, much like the flu. So now what we're trying to do is we're trying to better manage. All right. And I'm going to just put this data up again, because it's a lot of information, but you can see from each school how many tests that they did, how many resulted in negative, how few resulted in positive. And then over on the right-hand side is just the total. Over 1,300 tests performed for test to stay, for contact tracing, since the beginning of the school year, all to identify one positive case. Right?
And Dr. Kong, I just wanted to add some context to the one result. As we've often seen, as we've done this work, there was a household member who was indeed positive for COVID-19.
Yeah.
So even that one could be traced to a non-school scenario.
Yeah, exactly. All right. So that's how we're keeping schools safe. Now, how can we all further reduce our risk of getting COVID, getting Omicron? First and foremost, get vaccinated or get boosted, right? Studies have shown that 2 doses of the Pfizer vaccine was about 34% effective against Omicron, but getting that 3rd booster dose up that number to 75% efficacy. We also see that boosters can reduce your risk for hospitalization by 80%. All right, when you have a booster, you reduce your risk for hospitalization by 80%. But if you only have the 2 doses, you're reducing it by 65%. I want to highlight the table below to show where we're at in terms of our kids being fully vaccinated. We're doing okay in the 12 and up age range. They're pretty much equal at 76% fully vaccinated. I know we can do better. I know we can get that number higher. I want to emphasize the 5 to 11-year-olds. They were just, approved to get the Pfizer vaccine back in, I believe, November, and we're still lagging. We're not the only city. This is a number that I've seen in many other cities and many other states, but we're still lagging. And I urge all parents out there to please consider getting your child vaccinated. It is the strongest weapon we have to protect your child and to reduce their risk. Obviously talk to your pediatricians about it. We had pediatricians from MGH do a webinar, I believe back in November, and it was great. And if need be, we'll certainly have them back again. I also wanted to point out in my next slide, or in this slide rather, that we also have vaccine events coming up. So revere.org/vaccine is where you can get all this information. And I just pulled up next week's date here, or next week's calendar events here. And you can see there's many vaccine opportunities hosted at various places, one at the Garfield Elementary School, one on Shirley Ave, and another mobile clinic happening with the MGB Community Care Van, right? And these are all happening next week after school hours. So I hope you all take the opportunity to do that, to get boosted. or to get a vaccine. Now, speaking of boosters, a lot has changed since since the holiday break. I wanted to kind of go over again. I apologize if some of this is redundant, but I want to go over the vaccine options we have and who's eligible for a booster. Right. So the first is Pfizer. Anyone who is anyone who is 12 and up can get a booster shot of Pfizer. Pfizer is available to any child as young as 5 years old. 5 to 11s can get their primary vaccine series, which is the 2 shots of Pfizer. And anyone 12 and up can get the booster dose of Pfizer. Alrighty? When can you get the booster dose? You can get it at least 5 months after completing the primary Pfizer series. And what I mean by primary Pfizer series are the initial 2 shots. This is different. This used to be 6 months, but now they've reduced it to 5 months. Alrighty. For the Moderna shot, Moderna is still only available for folks 18 and up, and you can get that Moderna booster 5 months after completing the primary Moderna series. Again, that's a change. It was 6 months, now it's 5 months. All right. But I do want to focus on Pfizer because again, anyone above the age of 5 can get Pfizer. Okay, so that should be what all parents are looking for if you're interested in getting your child vaccinated. Focus on the Pfizer, and then 12 and up can get boosters. So try to get the booster if you are eligible. And again, you're eligible if you have received the primary Pfizer vaccine series at least 5 months ago. How else can you reduce your risk for COVID? Wearing a mask. This has been with us since the beginning, and it's not really any different. I will say that, if possible, wear a KN95 mask. I know the teachers all have them, and they are available online. I have mine right here, and I got it on Amazon. And if not a KN95, at least consider getting a surgical mask for you and your child and your family. It's important to wear, especially in public places, like a grocery store. And remember to cover your nose, okay? Like I said earlier, Omicron is very good at infecting the cells in your nose. So just remember to keep that covered. So in addition to vaccines and boosters and wearing a mask, the same rules apply for social distancing and hand washing. Those are all the foundational elements for reducing your risk. And remember, it's a layered approach. No one approach is going to 100%, prevent you from getting COVID, but you can increase your protection. You can increase your protection by getting vaccinated, then getting boosted, then wearing a mask and maybe upgrading your mask, and then maintaining social distance and hand washing. All those things layered together are integral and will help drastically reduce your chances of getting COVID. All right, and the last thing I want to mention are the new isolation and quarantine guidelines. These are very confusing, and as I mentioned, we are spending a lot of time trying to educate and help parents and staff kind of work through these ever-changing guidelines. I also want to mention that everything I'm saying is obviously subject to change. We're still living in a pandemic, and things can move quickly, as we've seen in the last few months with that very tremendous, very quick spike. So bear with us as we try to get you information, accurate, up-to-date information as fast as we can. But I just want to kind of, not to belabor the point, but the big change for isolation and quarantine is that if you test positive for COVID-19, regardless of your vaccination or booster status, everyone, regardless of that, should be staying home for 5 days if you test positive. Now, this can either happen on either a PCR test or on a rapid antigen test, alrighty? Stay home for 5 days. If on the 6th day, you no longer have fevers, if you no longer have a productive cough, and if all of your symptoms are resolving after 5 days, so either you have no symptoms or your symptoms are resolving, you can leave the house. But make sure you continue to wear a mask for 5 additional days, okay? These changes, they're all motivated by the science, which demonstrates the majority of the COVID-19 transmission occurs early in the course of illness, generally 1 to 2 days prior to the onset of symptoms and 2 to 3 days after. Alrighty, so we're following the science here. We never make any of these decisions alone in a vacuum. We look to the CDC, we look to the Mass Department of Public Health, we look to DESE, and we try to distill, parse through, combine, and distill all this information in a logical, science-based fashion to from all these folks into your ears. And we're hoping to again guide everything we do on the science and hopefully make for a safer school environment, a safer work environment for all. So I'm going to stop right there. That was my last slide. Thank you all for listening. Lauren, I don't know if you have anything to add, or if we should pass it on to the infectious disease experts to see if they have anything to add.
Yeah, I thank you, Dr. Kong. I'll just echo everything that Dr. Kong kind of mentioned. You know, as she mentioned, we have to continually adjust to what we're seeing and what we're experiencing in the schools. Dr. Kong and I are regularly in communication with not only the school nurses, but the school administration, the Revere Public School Administration. I myself am often in the schools. And so we are making decisions based on what we are seeing firsthand. And, you know, we are in regular communication with teachers and staff and nurses. And as Dr. Kong mentioned, right now, when we are experiencing a surge because of this new variant, we have to start prioritizing what we focus on in terms of safety, in terms of you know, resources and manpower. And the priorities that we are focusing on, as Dr. Kong mentioned, are the ones that we think will help the most in terms of keeping everyone safe at schools. And I think I'm going to end it there and pass it along to back to Dr. Kong.
Dr. Ingalls and Dr. Levitz, I didn't know if you guys had any comments you wanted to make before we started the question and answer.
I think you did a great job explaining things, and I think it's more important to hear from Lauren and you and everyone else who is, you know, the boots on the ground in Revere. We can try to answer some of the general questions in terms of vaccines and COVID, and I typed in one answer on the question and answer session, and we'll look at that in the chat, but maybe we can get to some of those. Richard, were you gonna ask those as you go along?
Yes, I'm going to pose them to the group. I just wanted to give Dr. Ingalls a chance to weigh in.
Yeah, I would just like to say that when you see the numbers on the news every night, it's a little bit frightening. When you think about, we've been going through this for a couple of years, but we really do see a light at the end of the tunnel. We are moving to a point where this is hopefully going to become a mild winter illness that we deal with every year, and we protect the vulnerable members of our society. We're not quite there yet because the numbers are honestly so astronomically high, but we are moving towards a point where we can see that this will come to some sort of resolution, and things will return somewhat possibly to a new normal, but we are getting there.
Thank you.
And again, to emphasize when that's said, if you're not vaccinated, get vaccinated. If you're eligible to be boosted and you're not boosted, get boosted. That's the number one thing that you can do to protect yourself and to protect your family, friends, loved ones. Dr. Ingalls and I are spending a lot of time in our hospital taking care of COVID patients. And I can tell you the ones that are in the intensive care units and the ones that are dying are almost all people that have not been vaccinated, or they have a very bad immune system. So do get vaccinated for yourself and for your loved ones. Do all the other measures like wearing masks when you're in indoor places, trying to distance. I know that it's difficult, if not impossible in some situations, but that's what it will take to get us through this one.
All right. The first question that I'm going to start with is a bit of a school-based question, but certainly would love to have some scientific input on this. It asks, can you talk about how you are planning on managing students in days 6 through 10 of their infectious period, especially given that there are students who struggle for whatever reason to properly wear a mask? So the one thing that I will say across the board that's been reported is that mask compliance has been good. I do know there are instances where the mask is on and perhaps below the nose, and it's often a simple reminder of lifting up the mask, and the student does as much. Can we talk a little bit about the kind of new quarantine period and what goes into a person whose symptoms have been resolving? They've been symptom-free for 24 hours on day 5. What are days 6 through 10 like for that person?
Yeah, I can get started with this question. I mean, Dr. Ingalls and I were actually talking about this earlier this week. And as I mentioned in the slide about the quarantine, the CDC is making these decisions with data. And the data suggests that you are most symptomatic 1 to 2 days prior to showing symptoms, and continue to be symptomatic 2 to 3 days after. There is data granted from non-Delta variants, so not Omicron or Delta variants, but non-Delta variants that suggest that after day 5, your infectious period drops. It kind of just takes a nosedive after that. So I think that's where a lot of the changes came from the CDC level. And don't forget that though you're exiting quarantine at day 6, you still have to wear a mask from day 6 to 10. And if the truth is that your child is going to struggle with that, then we would suggest your child stay home for the full 10 days, because that mask component is really there to also make absolutely sure that there is no spread. So whatever spread may be left, and I think the science demonstrates there will be little, we're going to make absolutely sure that that none of it is coming out into the atmosphere with the mask use. Lauren, any comments on that?
Yeah, thanks, Dr. Kong. So I just want to reiterate what Dr. Kong just mentioned. So obviously, we know there's a 5-day mandatory isolation period, and then we are advising everyone for the next 5 days to be diligent about mask wearing. Each school nurse has the ability to make a determination if a student, in combination with a teacher, in combination with a parent, is not able to effectively wear a mask. They can give guidance in terms of what that isolation period is going to look like for those individual students who we know have trouble wearing masks as well. I also want to address a period that keeps coming up a lot, that is lunch. For students who have isolated for 5 days and are back in school and are wearing a mask during their classes and in the hallways, they have to eat lunch. Dr. Kong, Dr. Gallucci, Dr. Kelly, and I are all aware that you can't eat lunch while wearing a mask. We understand that. And based on what Dr. Kong and the data is showing us, we also recognize that we think that your viral load is dropping off, and that eating lunch is not a high-risk event for these students who are coming back after a 5-day isolation period. And therefore, these students are allowed to eat lunch in the lunchroom with the other students in their class. This is because this is based on data that we are seeing that Dr. Kong has mentioned, that we don't think that the risk is that there is a significant risk to having students eat lunch who are back from isolation. And therefore, at this point, we are not having these students eat in a special room or do anything like that. They are able to eat lunch at this point. Richie, do you want to jump in?
Yeah, I echo what you both said. That has been the process. I know that our administration and those who monitor lunch have been vigilant about mask on until you receive your lunch. That's when the mask comes off to actually eat. And then once the student is complete with their eating, the mask goes back on. That's when they would get up to throw away their trash, sit back down, and socialize with masks on once again. That's been in place since day one, and that's a practice that will continue.
I think the data that Dr. Kong showed about the test and stay, how few cases there were identified, really demonstrates that you're not seeing spread in the school, even with those lunch periods. And we know there's a lot of COVID in the community. We know there are probably some asymptomatic or pre-symptomatic kids in the room at the same time. And yet we're not seeing spread within the school. So I think that should be very reassuring that it's okay to let your kid eat lunch at school.
There was a question about vaccinated individuals having the opportunity to participate in the testing program. The advice was that vaccinated individuals do not participate in the testing program, hearkening back to what we talked about earlier with resources and things along those lines. We made the decision very early on to continue to allow vaccinated members of our school community to participate in the weekly PCR test, the pool test, each and every Monday. So that's something that has continued. Those people, if they are indeed in a pool, would be eligible for a Binex test. What we're not able to perform is, I was established as a close contact outside of school. May I please Binex to see if I'm positive or negative? That's kind of what we're not able to handle at this time. So something that was posed in the chat. We do have a question. Let's see. We do have a question about KN95 masks, the masks that were provided to teachers upon returning. Each teacher was provided with 5 KN95 masks. We were told that the masks were non-surgical and non-medical once folks had received the masks. But from what I've been told is even still, those masks are more effective than a cloth mask. I don't know if anyone could speak to that.
I don't know if Robin or Sylvester want to jump in with something more intelligent, but from what I've been reading is that KN95 masks, the way masks work is that they have lots of like different densities of fibers, which will trap different sized particles. So the denser the mask, the more particles it can trap and the smaller particles it can trap. So an N95, which is a medical grade mask, is the one that is going to do the best job of trapping the tiniest particles and protect the wearer. That is medical grade. The KN95, I think you can probably even just tell by feeling it it's a bit more substantial and should trap more fibers. And what we do have from KN95 is a little bit more, I guess, homogeneity. Cloth masks, there's just so many varieties of them on the market that it's hard to know how thick, one mask could be very thick, one cloth mask could be very thick, but another one could be, pretty thin. So I think it kind of lends some homogeneity to the protection that all of the teachers are afforded with the KN95 mask. Dr. Ingles, Dr. Levitz, any other more intelligent way of putting that?
I think there's a bit of a misconception about what medical grade means. And, for physicians who have been wearing N95s pre-COVID to take care of patients with tuberculosis, for example, we get fit tested and compare different styles, different sizes, different brands of masks. And, you put on a hood and they ask, can you smell something or taste something? And so it's a medical grade mask because it's fit tested to your individual face. Non-medical grade masks means they are not subjected to that quality control that would require them to be fit tested to an individual. And I've also heard that there are also some issues with how some of these masks are exported. So masks that are exported to the US from China, my understanding is that they can't really be readily exported if they're labeled as medical grade, because that implies that down the road they will be fit tested in that manner. But the KN95s, the N95s, and the KF94s, they function because they're thicker. They also have electrostatic charge built in that also helps filter out a lot of particles. And they're certainly more reliable than cloth masks. And what I like about the N95s or the KF or KNs is that they're a little bit more three-dimensional than a surgical mask. So sometimes even though they're thicker and people might think they're harder to breathe through, they actually don't kind of collapse against your mouth when you're talking and breathing. And so some people actually find that three-dimensional style more comfortable to wear.
I agree, and the key is really to have it fit and to have a metal wire or something on top so that you can have a good fit around the nose. So a good surgical mask that's fairly tight works very well, as does a KN95 or an N95 mask. But if it's worn poorly, like down here, you can see the air is just going to go right in here, or the air is going to go on the side, or if it's up, the air is going to come underneath. So when you're wearing a mask, make sure that it fits really well. If you blow out and you can feel all this air coming along the side, or if you wear glasses, your glasses are fogging up, you don't have a good fit. And that can happen with any mask, a cloth mask, a surgical mask, a medical grade N95 mask.
Thanks for the demonstration. Dr. Lovitz.
So one question that's been surfacing, and I know this may be subject to further conversation, but folks are asking about the protocol for when we get a pool test and all of the Binex results from that pool test are negative. They specifically ask, should someone get a PCR test or be sent home until we get a PCR result in that scenario? And I know that's under review as we speak.
Yeah, that's definitely something we're taking under review. We know that for Omicron, the incubation period is actually much shorter, which is interesting. It's about 2 to 3 days versus like 5 to 7 for Delta and prior Omicron, other variants. So I actually think when you think about the way we're doing testing now, we're doing pools on a Monday, and then you could get a positive in that pool, but you might not get the positive results back for 48 hours, for 2 days, so Wednesday. And at that point, 2 days have passed, and we're going to binax, if Omicron was there on a Monday and it takes 2 days to kind of incubate, then you're going to get your binax on a Wednesday. I think we're starting to wonder and at least read the data and the science and wonder, well, should that be good enough? We're going to put that under review and see if we want to, accept the negative as, true, and maybe potentially the pools are false positives in that case. And, again, this pandemic's ever evolving, and our policies have to evolve as well to make more sense with, how this virus is evolving. I don't know if Lauren, Dr. Ingles, Dr. Levitz, if you guys want to jump in with a little bit more information on that.
I can talk about kind of the boots on the ground experience that we are having, and then I'm sure potentially either Dr. Ingles or Dr. Levitz could talk about more of the science behind why we're thinking the way we're thinking about this specific scenario. So I just want to review. Dr. Gallucci just brought up a scenario where we have a pool test that happens. We get the results of the pool test that there is a positive on a PCR test somewhere in that pool. And then all the kids in the pool, or all the staff in the pool, could be a staff pool, come down to wherever we're doing the binax testing, which is the rapid testing, and no one shows up positive on a rapid test. So previously, we were asking all of those people, as long as they were asymptomatic, to go get a PCR test to figure out who was the positive in that pool. Because Omicron has, obviously led to increased numbers, I want to make sure we're going back to that bullet point that Dr. Kong highlighted, in that we have to start prioritizing some different things now because of what we know about Omicron and because of what we know about the virus itself. And therefore, right now, we are prioritizing getting students out of school and giving isolation guidance to the people who show up positive on a binax from a positive pool. We're also prioritizing making sure we are getting the nurses, making sure that nurses are able to call back people who are testing outside of school to make sure they understand the proper isolation guidance. So those are, you can imagine, with the number of cases that we have right now, those two things alone take a large amount of time, okay? The other thing that the nurses have to prioritize is when a student comes to their office who is symptomatic, getting that student out of school and making sure the family of that student also knows what they need to do next. So those are the priorities that we have right now, okay? So we know that there are situations where we don't show a positive on a binax from a positive pool. And what we can assume from what we have learned about this virus is that as long as everyone in that pool is asymptomatic, remember, they're all getting a PCR test again the next week. So that's one thing. And also, we have to assume that the viral load of someone who's not showing up positive on a binax means that there isn't a huge risk for that person staying in a classroom wearing a mask. If they develop symptoms, that child is going to be going to the nurse's office and getting sent home. But we have to assume that the child or the staff who isn't showing positive on a binax is not a increased risk for someone in a classroom, as long as all of the other precautions that we all talked about are in place, which have been from the very beginning, which is masking, which is distancing, which is good hand washing, all of those good things that we have all been doing for the last 2 years.
All right. I am going to move on to the next question, and perhaps some of our doctors can weigh in here. What does it mean by resolving symptoms? I've seen a number of definitions as to what this means. So if you could speak to that, that would be great.
Lauren, do you want to take this one? You want me to do it? So resolving symptoms. So the easiest one is if you're in quarantine for the 5 days, day 0 is the day you test. So you're in quarantine for 5 days. And if by day 5 or day 6, you have no more fevers and no more symptoms, well, that's easy. You can leave quarantine, right? You're symptom free. You can leave quarantine, but be sure to wear a mask for 5 days after that. If, on the other hand, you still have symptoms, you want to make sure the symptoms are resolving. 2 big things. You can't have a fever anymore. Okay, it's not that your fever is getting lower, it has to be gone. You either have a fever or you don't. So if you didn't satisfy that requirement, then you're still in quarantine. You cannot exit quarantine. In terms of the other symptoms, we know that you can have a lingering cough. I see it all the time in my patients. You can have a bit of a lingering cough, have a little bit of a runny nose. You may have some lingering muscle aches, but as long as those symptoms are better on day 5 or 6 than they were on day 1 or 2, as long as you're moving in the right direction and you're you're experiencing a noticeable improvement in all those other symptoms that you may have had on day 1, then you're good to go. You're good to exit quarantine on day 6. However, again, make sure you mask up.
Anyone else want to weigh in, or I can move to the next question? All right. Oh, another medical question. Can you explain heart inflammation being discovered in teenage boys after the vaccine?
So, Dr. Levis, you want to take this one?
I just actually, I've been trying to answer some of the questions in the chat, and just as Dr. Gallucci asked the question, I had hit the send, and yes, it is a rare complication of the vaccine, heart inflammation or myocarditis, and it's much more common in boys, in teenage boys, than in teenage girls. Heart inflammation also happens after COVID, and actually your risk of getting heart inflammation is more if you get COVID than if you get the COVID vaccine. And the other thing I would add is that the heart inflammation in almost all cases, in addition to being very rare, those rare cases that occur, it almost all of the time it gets better. It just takes some time, it gets better, and then people are back to how they were before. With everything in life, there's a risk and a benefit to what we do. You go outside to the supermarket and a car can come, and hit you or whatever. There's nothing in life that's risk-free. The vaccines, I will say, have been remarkably safe and remarkably free of many long-term side effects. Most of the effects that are seen are these 1 in a million type side effects. On the other hand, people that get COVID, including children that get COVID, the chances of having, a bad outcome are much higher than the chances of of getting the vaccine. And it's estimated that over the next year or two, almost, in Europe, they're saying over half the population is going to be infected with Omicron. And I've seen similar projections for the United States. So, the vaccine is still your best and your safest bet.
I'll just add that it doesn't even seem that this report of myocarditis or pericarditis is specific to the COVID vaccine. It's something that can be reported with other vaccines, but we're seeing the cases now because we are literally giving millions of doses of vaccines. And the data from Israel estimated that the frequency of myocarditis was 0.002%. So really tiny risk. And if you count the number of cases of documented myocarditis in the US, it's a few hundred. And if you count the number of cases of this severe multi-system inflammatory syndrome that kids can get following COVID, it's close to 6,000. So again, every choice you make in life has some risk, but the data really says that the risk of the vaccine is far lower than the risk of the disease. And we know that infection in a vaccinated person may be runny nose, sore throat. Infection in an unvaccinated person can be quite severe.
There is a question about if a person had to quarantine for 13 days and PCR tested out positive again, do they have to do another quarantine for 5 days or more and do not have any symptoms? I think this falls under the 90-day no test category.
Yes, after you have a positive PCR, you should not test again for 90 days because your test can remain positive even though you're no longer infectious. You have some dead virus in you that causes the test to turn positive. So once you have a positive PCR test, do not test again for 90 days.
We have a school-based question that asks about the RPS dashboard and how often it is being updated. So that is being updated on a regular basis. We did have to do some catch-up work when we came back to the surge after winter break. The kind of game changer there was that we were no longer asking for confirmatory PCRs to consider students or staff to be positive. And so therefore we had to ensure that we had our hands around not only the confirmatory PCRs, but also all of the rapid tests, calls, emails that were coming in from families and being reported by students and staff. And so there has been a bit of a delay on the RPS dashboard, but our nurses have been working feverishly to get that updated and get the information to Jessica Gagnon, our lead nurse. And it's my understanding that they're making great progress and we should be on track and stay on track now that we have a handle around the surge and the new process. I also wanted to address, somebody had asked why we only presented 3 schools instead of our 11 in terms of the test and stay data. So those are currently the only 3 schools that are current with data input. And I think that's a testament and speaks to the incredible work and burden that the nurses have been bearing since the start of this pandemic. We certainly have the data, but it has not been inputted into the Crush the Curve website, which is the database that we use to track our test and stay results. So I did not want to put up a school that might not have been current. Those were 3 schools that were current and felt like it was solid data to share. We did have someone ask, will Revere Public Schools stay in person? As a student, I think over a third of our school students are out, including me, because we tested positive. I would encourage you, Not to venture a guess at the overall statistics, we certainly have experienced a surge since we got back from vacation, and I hope you're feeling okay, first and foremost. But I will say that it's been our goal to keep students in person. I think we all saw the effects of remote learning from last year that it has had on our school program. I think being in person with teachers and counselors and administrators and peers and health professionals on a daily basis is doing what is best for our students, which really guides all of our decision making as a district.
And I'll just add to that, Dr. Gallucci, that we did have a dip in attendance when we first came back from the holiday break at the beginning of January. But today our student attendance rate was 84% and our staff attendance rate was 94%.
Awesome.
So we're definitely on the other side of those trends. And I will mention, just because it's relevant, the attendance rate at the high school and at Seacoast is lower than that. And I think that has more to do with some older students making decisions for themselves about whether or not to come to school. So there's probably some different underlying situations there.
We have another school-based question that says some schools in Boston have been sending parents emails when someone in their child's class or a testing pool tests positive with no identifying information. Why aren't Revere Public Schools doing that? Parents have no clue how many kids are getting sick in their own student's class. More transparency is a good thing. I would say that our approach since day one has been to do the grunt work that's required to actually establish who is indeed in jeopardy in being around a student. So we did not take the approach of, if there's a positive student in class, we're going to send notification to the whole entire class, but rather look at a seating chart, identify who's around that student, ask the adults and the students in the classroom, have you been around this person for 15 minutes within 3 feet? And that's taken an enormous amount of work. But we feel that keeps students in school and gives a more accurate assessment of not only the positive case that's in the classroom, but also those that might be in jeopardy and identified via our interview process. It's extensive. We do it for each and every positive case in the building. And when there is an instance where someone is within 3 feet of a positive student, those families are contacted live and in person, just in case they have follow-up questions or want clarifications in regards to the scenario. A single generic letter doesn't provide the information that parents, caregivers, and guardians are going to want. We did get a question about hospitalization rate for children, specifically the high school who currently have COVID in Revere. I'm not sure if we have that data.
No, it's a little bit harder for us to access hospitalization data at a city level. And so I do not have access to that, although maybe some of the doctors on the call can speak about overall hospitalization rates.
I'm not familiar with the hospitalization rates for children with COVID. I know the numbers have been going up, but in general remain not as high as what we've seen in the past for past variants. For like adults getting admitted to the hospital. Again, I don't have that data at like a Revere Public School level though. I don't know if Dr. Ingalls or Lovitz, if you know about the pediatric hospitalization data. I will say that what we're seeing now, we are seeing a bit of an uptick in hospitalizations, but what a lot of hospitals, I imagine, are I know MGH is seeing this, and I imagine BU and UMass and other hospitals are seeing the same as well, is that about half the cases, half the COVID admissions in hospitals, patients are actually coming in for a different reason, and they just happen to be getting diagnosed with COVID because it's a hospital policy to test everyone who is getting admitted to a hospital for COVID. I actually just opened up my email and I got a new email like 2 minutes ago from MGH
51% of our COVID hospitalizations in adults are for things that are not COVID, and we just happen to have found COVID while they were kind of getting admitted into the hospital. So again, it is a milder illness. We are seeing an uptick in hospitalizations because, as I mentioned, the volume is just so incredible. So though it's a milder illness, just so many more people are getting it. And it seems like it's not what's driving folks to the hospital. It just happens to be there on presentation when someone is coming for something else.
Yeah, we're seeing the same thing. And I think the state is trying to track that now. You know, one of my friends asked me, well, why haven't hospitals been doing this all along? Because a year ago, we didn't really have asymptomatic COVID. You know, a year ago, we weren't all vaccinated and we had much more really virulent variants circulating. And now we are at a point where we do see asymptomatic COVID. And so it's a good thing, but we have to figure out a better way to tease out the numbers. From a hospital standpoint, it doesn't change so much how you operate because you still have to isolate these COVID positive individuals. They need probably, you know, private rooms. You can't send them out of the hospital if they need to go to, you know, a homeless shelter or a skilled nursing facility. So from an operational standpoint, it doesn't matter so much for the hospital, but I think it will help reassure people that we are moving towards a improvement if we can tease out those numbers for people a little better.
I'm going to read a couple of the questions from YouTube. The first one is, when a child is pool tested, how long does it take to get the results back? So up until we came back from break, we were getting the results back the same night and able to start our reflex testing the next morning. But starting last week and continuing, well, last week, it took us 2 days to get the results back. This week, it took us over 24 hours. So there was a day between when we got the results back and when we actually started the reflex testing. And then there's another question. And I should say that we anticipate we'll be getting back to regular rates as we continue. The number of students and staff who have elected to be part of our pool testing program varies by school. The lowest participation is at Revere High School, where we have about 35% of our population participating, but we think that is because so many more people at the high school level are vaccinated. At the elementary level, we run between 60 and 80%, with the Beachmont School being a bit of an outlier there. They actually have 85% of their population doing the weekly pool testing. So that's exceptionally high. And the middle schools are all right around 60 to 70% as well. So it's still significant portions of our school populations that are testing, especially among the not vaccinated or less likely to be vaccinated groups, which is encouraging. And somebody also asked if there's a plan to discontinue pool testing in the district. There is not. As long as the state continues to let us do pool testing, we will continue to do that. I don't know, and maybe the folks who've been here all night can tell me if you already talked about ideas around test to stay. No, okay. So one of the things that we are considering, and this isn't finalized yet, but when we look at the workload on our nurses and where we're seeing their work be fruitful in terms of keeping our students and our staff and our schools safe, we are finding that time is better focused on engaging with the families of positive students and engaging with staff who have tested positive to make sure that they understand how to be safe and how long they need to isolate for and what symptoms they should monitor before they come back to work or back to school and all of those pieces. We have been collecting some data around test to stay, and I know that we have 3 schools that are completely up to date with their data analysis, and among all 3 of those schools, we've only realized 1 positive case from the test to stay program. So we are questioning whether it is fruitful to have nurses spend a whole nother day every week doing the Test to Stay program, or if it is better for them to spend their time really working with staff and students to make sure those who have tested positive for COVID are getting the care that they need, and seeking additional care when their symptoms are not remediating themselves. I don't know if anybody wants to add to that.
I'd just like to add one clarification, because those numbers can be staggering. So we have received positive Binex results when we've used rapid tests, but those positive results have come from a response to a positive pool the day before. So I just want to distinguish between the two.
Yeah.
We have a pool test on Monday. We have 5 children in that pool that are tied to that pool. It's come back as positive. On Tuesday morning, ideally, if we get the results Monday night, we Binex those 5 children. We may get 1 positive, we may get 2 positive. Let's say we get 2. If we get 2 positives, we then take the next step to talk to adults that were in those classrooms and say, are there any close contacts to these 2 students that we identified? The close contacts we've gotten back, that's the data that you saw tonight.
That's what I'm talking about. That's where Test to Stay comes in. When a student tests positive, they go home, and that's the end of it. They isolate and do what they need to do according to the protocols. But Test to Stay is for students we've identified who are close contacts but have not themselves tested positive. And so what our practice has been to date is that those students who are identified as close contacts get Binex every day we were at 7 days. I think we're at 5 days now. And out of all of that testing, only 1 student has ever, in those 3 schools, I mean, it's not a complete set of data. We do have 8 other schools, and we are working on getting that data, but it's pretty significant to show that across 3 schools over a 6-month period, we have found only 1 student. And that's been a whole lot of time that nurses spend every morning for 5 days retesting and reswabbing those kids. And I keep saying nurses, but I want to give a shout out to our health techs as well, because they're the ones who are in large part doing a lot of the swabbing and assisting the nurses in setting up these protocols and programs as well.
I just want to move to a medical question. If a student recovered from COVID, do you still recommend the vaccine for that student? And at what point should they get the vaccine?
Yeah, I think Dr. Levitz has actually been answering some of these in the chat throughout. And yes, your student should still, same as adults, if you had COVID, it will still be helpful for you to get the vaccine. Once you have recovered from COVID, that's the key. You don't want to have symptoms of active COVID and then get the vaccine. 1, because if you have symptoms of active COVID, you should be isolating. But 2, if you have a fever, if you have difficulty breathing, if you have chest pain, we don't want you to get a vaccine in that stage. So please fully recover from COVID, and then you can go ahead and get your vaccine. Dr. Levitz, any other guidance on, like, I don't know if you've heard of any hard and fast like day rule? When there's
most people say somewhere between 10 days and 90 days after the episode of COVID, and that's generally what I recommend. And to reinforce what you just said, Nat, you also want people to be symptom free and feeling better. But you are at risk for getting COVID again, and the immune response and the protection you get from the vaccine is actually a lot better than the protection you get from a natural COVID infection.
Remember in the early slides I presented, there's data showing that if you had Delta, that immunity is not going to protect you against Omicron. And we're seeing that because some of my patients have been getting COVID twice. This is their second go around. So something to consider, and I hope something that pushes you all to consider getting the vaccine for either yourselves or your children.
Couple of questions about operating procedures. So someone asked, is there or can there be an RPS pool testing dashboard as well? So I will tell you definitively that positive results from our pool testing are already included in the dashboard. So that one is taken care of. Somebody asked, why can't pool testing be made mandatory so that we can test everyone in school and not just the small sample that actually signs up? To echo what Dr. Kelly said, participation rates have been very high, especially at the elementary and into the middle school level. We still struggle with the high school level, but that's also our group of students that have the highest vaccination rate. We did start out this year hoping to get an opt-out only so that we wouldn't have to chase down approval consent forms from each and every student in the district. We didn't get that approval, so we did that hard work of calling families and chasing down those consent forms to make sure we could get as many people in the pool test as possible. That was our goal. It continues to be our goal. And we continue to add folks each and every week as we go through this process. A teacher asked, will teachers be made aware of students that are returning from an isolation period? I will tell you that we never rely on a student as the sole historian. Our nurses or administrators contact teachers to make them aware of a positive case. So therefore you would know when that student returns that they're returning from a positive COVID scenario.
Somebody asked about the pool sizes, if the staff are also reduced to 2 to 3 people per pool. And we did start that transition this week in reaction to the results that we got last week. And that was, we saw that to be very successful, and we're going to continue with that until we see positivity rates decline.
Someone posed the question, so students can eat maskless, why do they still need to wear a mask? And COVID does not stop at lunch outdoors. Very confusing. So what I would say to that case is, whenever we can take precautions, we take precautions. It does not make sense right now where the weather is in single digits to go outside for lunch. But as the weather begins to turn, we're certainly going to go back, if we're still in the scenario that we find ourselves in, to eating lunch outdoors. It's a safer environment. Kids can distance more. We have the fresh air. So whenever we can, we do take precautions. And that's our approach with each and every scenario in the school program.
And just to piggyback off that, remember it's about layering precautions too. There's never just one thing that we do or that we rely on to protect us and your children fully from COVID. It's all about mask wearing on top of vaccines, on top of boosters, on top of distance, all these things taken together that we enforce and try to use day in and day out.
Somebody asked, what does resolving symptoms mean? I've been searching and there are so many conflicting answers. I don't know if one of the physicians can respond to that.
I did answer this question, I think, a little bit earlier.
Oh, okay.
Basically, you're in a 5-day quarantine. If on day 5 or 6 you have no symptoms, great, you can exit quarantine. If on day 5 or 6 you have a fever or a productive cough, or difficulty breathing or chest pain, you have severe symptoms, do not exit quarantine. You need to at least be fever-free on day 5 or 6 in order to exit quarantine. However, if on day 5 or 6 you have no fevers, you still have a lingering cough, it's a dry cough, maybe some muscle aches, as long as those symptoms of muscle ache, cough, runny nose, as long as those are all heading in the right direction and are getting better compared to the first day you were in quarantine, you're good to exit quarantine on day 5. But remember, you must wear a mask. Even if you have no symptoms on day 5 or 6, or if you have resolving symptoms on day 5 or 6, you must wear a mask for the 5 days after you exit quarantine.
We did have a question that asks, if a child has no symptoms and they are fully vaccinated, but mom, dad, and sister have COVID, why are they allowed in school? Can't they be asymptomatic? Shouldn't they be getting tested before returning?
Sorry, repeat that question, Richard.
Sure. So it's a child that's fully vaccinated. They themselves are negative, but every member of their household, let's say 3 other household members, are positive. So if that child is fully vaccinated and asymptomatic, they ask, can they return to school, or should they be returning to school, or should they get tested before they return to school?
But I think Lauren's going to take that. I'm going to mess it up.
So this scenario is addressing the fact that people who are vaccinated are in a different category than people who are unvaccinated. The CDC and the Mass DPH and most other entities recognize that if you are fully vaccinated, you are no longer considered a close contact and therefore can continue to work and continue to go to school with the other precautions that we all have in place. For example, mask wearing, which we do in city buildings, which we do at schools, and other precautions. So they can come to school. If someone who is fully vaccinated who has an exposure to COVID is not considered a close contact. Obviously, we always recommend that people monitor symptoms, and if symptoms develop, that they stay home or go home and get tested. We also recommend that you test the 5th day after exposure, we recommend that you test the 5th day after exposure as well. But these students are not considered close contacts and therefore can continue to come to school.
All right. Someone asks, if you had Delta and you are still in the 90-day period, is your immunity good for Omicron, or is it possible to get Omicron within those 90 days? And if you show symptoms, should you rapid test? Kind of a Delta versus Omicron.
I would assume yes, because like I said, Delta doesn't appear to, an infection with Delta and the antibodies you get with Delta do not appear to give you any sort of protection from Omicron. And I think that is regardless of what day period you're in. Okay, so it could be 90 days, it could be 120 days after, it could be 30 days after. My understanding is that the time period doesn't matter, it's not protective. Treat any symptom of potential COVID as if it was truly COVID and not just, allergies or something else. I would, definitely seek out testing, either with rapid testing or PCR testing to confirm if you are positive or not. And obviously, try to isolate yourself until you can get results of said test and kind of do the usual things that you're accustomed to doing if you are experiencing COVID symptoms, regardless of whether you had Delta in the past or not.
Someone asks if we're counting on children to decide whether they're fever-free or symptom-free after day 5. Certainly, we're counting on parents, guardians, and caregivers, as we have from day 1, to be sure that their child is truly resolving before they return to school. I would encourage everyone to review the checklist that has been sent multiple times over the pandemic. Yeah.
There was one question about whether or not parents should send copies of students' vaccination cards to the schools. And that's not necessary at all. We're not collecting vaccination cards on students.
We have a question. Is there a new strain of COVID that has Ebola type symptoms or bleeding eyes, nose, and mouth?
Not to my knowledge.
Okay.
No.
Dad, no?
No.
It's at 7 p.m. I don't know if you guys want to start to wrap it up. I just want to be mindful of everyone's time.
Yeah.
Very impressed that people are still with us right now.
I know.
We're very thankful for your time, Dr. Kong and Dr. Engels and Dr. Levitz, and Lauren for yours as well, and also for the time that our translators have put in to make sure this is accessible to all of our families. And thank you to the families and the staff members who took the time to be here tonight. We'll definitely have more of these forums coming up in the future.
Thank you, everyone. Good night.
Thank you. Stay safe, and thank you. All the parents, the teachers, the students. This is just a really difficult time. I think I'm the oldest one of all the panelists here, and I can say that this is a once in a lifetime event. It's very difficult. We're all working very hard. We're all trying to do the best thing. The science changes all the time. We're learning new things, and we adjust as we learn new things. But I've just been, as an outside observer here, I've just been very, very impressed with the dedication that has been shown by all the folks, Diane, Richie, Nat, Lauren. Everybody is just working very, very hard to try to keep everyone safe and also keep the children learning. So I'm just very impressed, and thank you to all the parents and students and everyone else.
Everyone calls the doctors and nurses the heroes, but as a parent of a high schooler, I think the educators are heroes right now.
Yes.
No doubt.
And thank you to our translators. You've been going for
Yes.
90 minutes. Amazing.